Welcome again to all the viewers. We are here to continue our earlier discussion on breathing, but this time we are going to discuss precisely on the techniques, and we will be all surprised that wellness is not just from the supplement or going to the gym, but it's just right under our noses. So here we are again, and let's listen to Dr. Cristian to give us insightful techniques on the proper breathing for overall wellness.
Yes, nice to be with you again. So this is second part of the breathing, of the aspect of using the lungs, not only for the bringing the oxygen in, but more for activating the biomechanical function, actually to the entire body, or at least for the organs that are within thoracic and abdominal region. It's very, very important, much more than we can imagine. You see, when we breathe in, we expand the lungs. And when you expand the lungs, the thoracic grows, getting big. Now, it's very important, which I advise.
Dr. Cristian, to interrupt a bit, when you say the thoracic, where exactly is that?
It's the upper level, above the abdominal area,
okay.
Right? Start from like above the stomach all the way to the neck.
So and another thing is also, just to clarify, is we breathe in. Some people breathe in through their mouth. Some people breathe in through their nose. They exhale through their mouth. So maybe, yeah.
Now, the important things doesn't matter for the mechanical point of view, for bringing oxygen within inside the body. Really doesn't matter through which hole we breathe, nose or mouth. As long as take the air in, and as long as the oxygen gets in, as long as the lungs expand, from my point of view, doesn't matter if you breathe through the nose and mouth. But there is two aspects which is taken account. When you breathe through the nose, some of the bacteria, some of the toxins that are in the air, they stop in the nose. They don't go all the way to the lungs. So we avoid sometimes to really bring toxins in the body. So the nose act like a small filter. So that's why a lot of people has allergies, because the nose when the nose is being used as a filter, a lot of impurities from the air stop in the nose. That's why it's very important the nose should be clean. The way we clean your mouth with a toothbrush and toothpaste, the same way to clean the nose twice a day, morning and evening, sucking the water, salted water through the nose and spitting through the mouth. So this way we clean the nose for the impurity that remain through. Very nice point, Mukesh. Very nice. Now, another aspect of difference between breathing through the nose and the mouth is when you breathe through the nose, because the nostrils are small, right? So you breathe in slower, so the lungs expand slower and avoid of any kind of trauma at the intercostal level, right? Now,
we should not put too much pressure in the inhaling. It's just a slow process.
You can, if you do the nose, breathe through the nose, you can put as much pressure as you want, because the nose doesn't allow much pressure, because it's a small nostril. Now, when you breathe through the mouth, is the one that you should not really put too much pressure, because the mouth, just being wider, more open, you can breathe a lot of air inside. That's why it's very important to use the nose. But now, when you have an athletic activity, run, or when you swim, or it's better to breathe. You can also breathe through the mouth, because a larger quantity of oxygen gets in, because it's needed larger quantity, especially when you breathe through the mouth. You don't have time to breathe slowly through the nose, because you just take the air out from the mouth, the head out of the water, and you breathe quickly. So you have to breathe through the mouth when you're in a swimming activity. On another activity, in general, when it's a sport activity, to breathe through the mouth will be better because it needs a large amount of oxygen at once. Now, I would like to advise another aspect. Most of the people, they don't breathe proper because they just breathe in the chest. Chest is the thoracic, right? So you expand your lungs horizontally, right? But the most help that the lungs expansion can give to the body for the biomechanical function, for the health point of view, is to breathe down, vertical. Breathe, horizontal, expanding your chest sideways, expanding your thoracic sideways, but it's very important to breathe abdominal. The lungs expand down because the most help that the body can get for the lungs expansion is when you breathe down, because the lungs expand downwards, pushes the diaphragm down, and through the diaphragm pushes the liver, the spleen, the stomach down. And this way, lungs is a part of the biomechanical activity, which is precise biochemical activity, which helps biochemical activity and help the function of the liver and the spleen. When you breathe down, you expand the abdomen.
Dr.
Right?
Cristian,
Yeah.
talking about breathing down, maybe you can explain to the viewers how do we breathe wherein it goes all the way down to our the abdominal, right? You mentioned earlier.
Well, there is two ways.
Yeah.
There is two ways. When you use the breathing as a therapeutic, then you do slowly and you breathe. I will talk about that. Where you breathe, you expand the entire abdomen for the pubial region, all the way up to the upper chest, right? Now, but the breathing, daily and all the time in every day, you have to, when you breathe down, that means when you breathe in, you make sure you always expand the stomach region, expand the abdomen, the upper abdomen. Because when you expand the upper abdomen, meaning that the lungs go down, pushing through the diaphragm, pushing the spleen, pushing the liver, and pushing the stomach, and help those to function much more effective and much better. Always when you breathe in, you have to see that the stomach expands a little bit or more, or depend
expands outward, right?
Yeah, outwards, right?
Because some people, when they breathe in, they suck in the stomach.
That is
right?
this is the worst.
Yeah.
That
So that would be the proper way. So we breathe in and the stomach expands.
Yes. Okay. Now, when you breathe in the normal, right? Everyday breathing, all day breathing, all the time breathing, always the stomach has to expand when you inhale and has to really go back to normal when you exhale. So, this movement, it helps the liver, help the gallbladder also, because when you breathe in, the gallbladder wall contract and pushes the bile into the intestine, so that you avoid to build up stones in the bladder, gallstones, right? So you hear a lot of people having stones in the gallbladder. The gallbladder has to be eliminated. That is because the gallbladder doesn't get contracted to pushes the bile out, and the bile stays on the wall and form like a stone. We call stone, but actually there is a gummy consistence. So the fluid, the bile fluid stays over there and deposits there as a sediment and forms stones. But when you breathe deep, when you breathe in and the abdomen gets expand, also at the same time the bile movement start pouring out from the gallbladder. So this way it helps to avoid building up stones. It helps also for the intestinal digestion. It helps also to make the fluid, the bile fluid. It helps the intestinal chyme. No, it helps the bowel to really get softer and to go out, to be a little bit dissolved with the bile fluid. It has very important the things. And also, when you breathe in, you push also the spleen. Now, when you push the spleen activity is increasing. So the spleen chemical activity is depend of the mechanical activity. So this way the spleen can work better. But it's even something very, very tricky. Now, below the spleen is an angle of the large intestine. The large intestine make a small curvature. So over there, most of the people get that one because doesn't breathe shallow, doesn't breathe deep down, doesn't push the abdomen down. So over there, it kind of create diverticulitis because the fecal stays too much there. So that also provoke the constipation or diverticulitis or irritable bowel movement. But when you breathe in and the abdomen rise while you breathe in, so pushes the spleen, the diaphragm pushes the spleen in down. Also, when the spleen goes down, also pushes in that angle and help the large intestine over there, the descendant colon, where the descendant colon starts right there where below the spleen, pushing the descendant colon to move down the bile, so you have better intestinal movement or float, and so you see that is always try to while you breathe in to expand the upper abdomen. Now, of course, when you really want to treat a problem with the bladder, cystitis, or kidneys, now the deep breathing, the breathing to expand all the way the abdomen, all the way down to all the way from the basin, from the pubis. Then when you expand that one, also it helps very much the mechanical movement, helps very much the bile, the urinary
tract.
It helps the urinary tract infection. That I use this one is the urinary tract infection all the time, but it helps all the time to the vesicula to really eliminate the fluid, especially when the man has a prostate problem. When you breathe deep and sometimes doesn't the urine from the bladder doesn't go down when you do those breathings, because it doesn't go down because there is some prostate problem, or because some adenoma of the prostate goes below the gallbladder. It presses or squeezes the sphincter. Now, but when you breathe deep, expanding the lower abdomen, then it pushes the bladder to help the bladder to push down the urine. It's very important. When you go in the morning and you cannot really move down the urine for when you have some little problem with the prostate or the problem with the sphincter, the bladder sphincter, that when you go there and try to expand lower abdomen. You can put the hand in the lower abdomen. You breathe deep, breathe in there, relaxes the muscle, breathe in. So you'll see that whatever through the inhalation, the push of the lungs into the organs, into the intestine, it pushes also the bladder and pushes the urine to go out. It's very helpful, things. So
another thing, Dr. Cristian, is there a specific rhythm in breathing? Let's say we breathe in for how long and how much do we also hold, and do we,
I don't think we should watch so much the breathing, because it becomes an obsession.
Okay.
So you don't want to get addicted. Like some people get addicted to check the blood pressure 3 times a day or all the time. No, we don't want addiction. We have to go on with our life to let the body to function on its own. We just try to supervise the body if function right, function good, but don't think all the time at that, because if you think, you become obsessed, you become addicted of the controlling, you become control freak to your body. So that causes stress. Just simple. You breathe and you feel like. Of course, when people, when they are athletes, when they are hard, it's because also the breathing is also related with the rhythm of heartbeats, right? So when you have a big heart and you are an athlete, you don't need to breathe so often. Now, it depends also how big the lungs are, because there are some short people that are small lungs, but the same some short people which are big lungs. So they just use the lungs the way the lungs want. It's a reflex. All those things are controlled by the breathing center within the brain, and they know exactly how to correlate and how to relate, how to impose the rhythm of respiration. It depends a lot.
So you just breathe in enough
You breathe
air
in-
that you can handle to hold.
Exactly. You breathe in
Okay.
enough air as much as the body needs, but it's very important when you breathe in to expand the stomach, the upper abdomen. It's that this way, that means you allow the lungs to expand downwards vertically, and also to help the activity of those upper abdominal organs. It's very important. Of course, you can breathe laterally also because that helps the heart. But you breathe when you breathe laterally, expand the chest left to right, also help the muscles of the neck to relax. It's very important. So, but what we should be worried to breathe to breathe vertically, to expand the lungs downwards, because that is the most important biochemical activity, metabolic activity sustained by liver and spleen, liver, stomach, intestine. That is very important. Yes. Yeah?
Yeah.
16, right?
Yes.
Yeah, we'll go another 2 minutes. Okay. So I think it's we are towards the end.
Yes.
Maybe in the future we'll do one more video to show practically some exercise for some special disease. Actually, let's go to 19 minutes here. Now, simple. If you really are stressed, what I suggest, lying down on the back, putting one hand on the stomach, one in the chest, and breathe in. Started 6 seconds in, 7 seconds hold, 8 seconds out, or you can start even 4, 5, 6. And if you really increase every 1 week or so, you'll reach up to 8 in, hold it 9, release 10. This is in general for any problem with the spine, because when the thoracical expand, the disc also, the vertebrae go away from each other, releasing pressure from the disc. Now, when you have the problems with the heart, you can put one hand in the left side, one hand in the right side, like that, and you breathe in upper thoracic, and just this helps to relax the heart muscles. When you have problem with the neck, let's see, when you have numbness, the pinch nerve in the left side or right side, if it's on the left side, put the hand here, leave the head to go sideways, and you breathe 6 to 8 times. Breathe in 4, hold the 9, hold the 5, release 6, or whatever one. Just to stretch the neck region to release the pressure in case there is a pressure on the disc on the brachial nerve. The same thing on the other side. So this is very helpful for the neck. And of course, if you have stomach problem, put one hand in the stomach or both hands in the stomach, and you breathe here, expanding the stomach as much as possible. But you have to lie down on the hard surface. Lie down, breathe in again. You start 4, 5, 6, or 6, 7, 8. Doesn't matter. Start with little and increase up to 8, 9, 10 as you feel comfortable. The breathing should be lying down breathing should be between 10 and 15 minutes. So this, I say, for the remove the pressure for the brachial nerve, it should be done sets of 6 to 8 breathing, 3, 4, or 5. It's very important also for the back problem. You're lying down and you put the right leg over the left one, and stay there, and you breathe 15, 20 times or 30 times. Again, breathe abdominal to make sure you stretch the lower back spine. Breathing can be used as a tool for any kind of disease, any kind of problems. It's very important. If you just feel that you have some problem, even with the thoracic region, you put the hands lateral here, and you breathe, and then you release the tension in the upper thoracic region, in the upper spine, in the upper back region. So this way you remove the spasm over there. It's very important, the breathing for any kind of disease. So I kind of show you just a little bit use of the breathing. We'll put in this Facebook a lot of other position for different treating various disease. See, as I said, the one that putting the right leg over the left and twist and breathe abdominal, that is very effective for the kidney problem. If you have kidney stones or kidney doesn't work proper, you just be like that and breathe like 25, 30 times left, 25, 30 left, 30, but the number of 20 or 30 left and right, just at the edge of the bed, lying down, and leave the foot, the leg to drop down. That stretches the lower back and stretches the kidney, stretches the kidney region, stretching the upper urethra, the tube between the kidney and the bladder. So also the breathing help on this one, releasing the side part of the lower back where the lungs are. So you see, it's a lot of situation where the breathing can be used on treating various disease. I think we stop here. I think we
All right.
cover up everything.
Yes.
No, Mukesh?
Yes.
There is anything else that you think we
I
didn't?
think that's about it for today.
Yeah.
And once again, so much insightful techniques and conversations on how overall wellness with the proper technique of breathing from Dr. Cristian Rachitan. We will see you soon once again. And if you have any questions once this is posted on Facebook, just put it on the comments and send in your questions. Thank you.
Take care,
Thank you,
all
Dr.
of you,
Cristian.
and thank you. I thank you for your wonderful guidance here, Mukesh. You are the best and unbelievable. I never thought that can be such a great hostage here. And see you next time. Take an account the breathing and use those exercises and get help with the breathing mechanical action. Bye-bye.
Bye.